Opthalmia neonatorum is a term which we give to a neonate who's having different type of discharge and any pathology specifically associated with eye directly after birth. Now there could be number of factors that can cause this. They have a specific day of presentation with a specific type of discharge, though their symptoms and signs are overlapping, but they have a specific treatment. Now going into the detail, the most common bacteria that is responsible for causing Opthalmia neonatorum is chlamydia. It specifically presents at 5th to 14th day after birth with a mucopurulent discharge from the eyes. In the conjunctiva, there will be a mild papillary reaction. By this we mean that there will be small finger-like projections that will start developing in the conjunctiva, and in the cornea there will be superior corneal pannus formation. Now for chlamydial ophthalmia neonatorum, we have two treatments: the topical antibiotic tetracycline drops, or we can give systemic antibiotics erythromycin. Talking about the second most common bacterial cause, that is gonococcal. Gonococci presents within 2 to 4 days after birth with a purulent discharge. Now this purulent discharge differentiates it from chlamydia, which has a mucopurulent discharge. Now in the gonococci, the eyelids will become swollen and the cornea will have an inflammatory reaction known as keratitis. Now for gonococcal ophthalmia neonatorum, we will prescribe the patient with topical antibiotic, that is benzyl penicillin, and systemic antibiotic cefotaxime. Now for other bacterial causes, there could be staphylococcus, streptococcus, or H. influenza. Now they will present between 4th and 5th day and with a mucopurulent discharge. Though their discharge is similar to that of chlamydia, but the day at which they present is different. In these bacterial infections, there is quite similar sign and symptom as compared to other etiological factors that causes ophthalmia neonatorum. That includes eyelids become swollen and the conjunctiva become hyperemic. Now by hyperemic we mean that there will be excessive blood vessels conjunctiva. So for this we have either neomycin, tobramycin, or in terms of systemic antibiotics we can also give cefotaxime. Now in the virus, HSV2 is etiological factor, though it is rare and it has no specific day at which it will present, but the characteristic feature that differentiates it from other factors is the watery discharge. Now it will cause blepharoconjunctivitis as well as keratitis. Blepharo is the involvement of eyelids, the conjunctiva gets involved, and keratitis is the involvement of the cornea. For this we can give acyclovir in the form of topical antivirals, or we can also give the patient some antibiotics. Now if the chemical, for example silver nitrate, which is most notorious for causing this, it will present specifically within few hours of birth. It will have no specific discharge, but the conjunctiva will become hyperemic. There will be increased redness in the conjunctiva. So the treatment for chemical etiology is simply wash it so that the chemical can be removed and the baby can be cured of this eye pathology. Now let me show you some diagrams. So as you can see, this is a mucopurulent discharge with swelling of the eyelid. Now because of this mucopurulent discharge, we can think that either it will be chlamydia or any other bacterial involvement. So we will ask in the history that at which day it presented. So if it was 4th to 5th day, it could be any bacterial infection other than chlamydia, or if it presents from 5th to 14th day, then we can think that it could be chlamydia. Here as you can also appreciate that there is discharge, mucopurulent discharge. There is quite an amount of swelling in the eye of this neonate. Eyelids are involved.